So let's take some time to go through the VisualDX mobile app for the iPad, which is also available in an iPhone format as well as a web-based format for viewing. When you open up the application, you'll see the two main ways in which this application is used. There's a differential builder on the left-hand side and a diagnosis lookup. Each has their respective strengths, and let's look at the diagnosis lookup feature first. Now this tends to be a lot more handy if, of course, you're looking for a specific disease process or in a basic sciences scenario as a first and second year medical student. This will come in handy to look at examples of certain pathology. You can simply type in the name of what you're looking for up here, or you can choose to just browse through all of the multitude of different pathologies available. So if you look at one of these titles, for example, we'll do alopecia. When you click on that, you'll see that on the top part of the screen here is a list of images which you can choose through, and if you simply click on one of them, it'll give you a full screen image which you can then enlarge to your liking and take a look at that image in more detail. When you go back to the listing, you'll see that there is a diagnosis synopsis, what to look for, diagnostic pearls, some differential diagnosis and pitfalls, and a lot of other very useful but yet concise information about the disease, some references within PubMed with links to PubMed, and some associated findings down below that help you sort of figure out how this presents as a disease process. Now I think the most useful way to use this application is actually the differential builder. So if we go back to the home screen here, you'll see this differential builder on the left-hand side. Now, in a clinical scenario, often you're presented with a rash that you're really not sure of what it is, and this helps you do a step-by-step sort of differential that will allow you to figure out, or at least narrow down, what that diagnosis could be. So you can choose from a multitude of different clinical scenarios, and we'll start out with some of the easy ones, such as adult skin, and then you can either choose from a series of different patient populations: adults, dark-skinned adults, elderly, or special situations such as international travel, bites and stings, etc. We'll choose one of these, and you'll see that on the left-hand side you can now add the findings that you see on the examination that should help narrow it down. When you click on Add Visual Findings, it'll give you a list of options to choose from, whether you have papule plaque, an erosion, flat macular. It goes through some of the key terms there to look at. Okay, let's go ahead and choose just a smooth plaque. And you'll see as you put in each entry, in the background the diagnosis is being, the differential is being built. And you can add more visual findings should they be needed, or you can focus on different parts to build out the differential. You can add a body location, such as, I'll say, the face. And you'll see in the background that this updates. You can add multiple different locations or distribution. You can say scattered, acral, photo distributed, and it'll describe that in the diagram there. Go ahead and go back to patient findings, and you can add some other findings as well, and you can multitude of things to choose from, whether it's medical history, occupations, etc., etc. So when you want to look at the differential that has been made for you, simply click off to the right hand side and you'll see kind of the breakdown of what you found so far, and much in the similar format as before, simply click on the image and you'll see images at the top of the screen here that you can choose from to look at. Click on it, enlarge it in much of the same way as you did beforehand. You can go back and then read a little bit about spider bites, for example, with the diagnosis, synopsis, more and more detail about spider bites, what to look for, diagnostic pearls, differential diagnosis, best tests, management pearls, therapy if applicable, and some references, as well as associated findings of what to look for on your examination. Again, not a very complex app as far as all the different menus, but it is extremely useful in both clinical and basic science scenarios. So that's the VisualDX mobile app.